Hi everybody, my name is Diamond and today I'll be presenting my Polygence project to you. I completed this project with my mentor Neocor and we did a paper about Noma, which is a neglected tropical disease. So this is just the table of contents. So I'll be talking about Noma, of course, also known as Cancrum oris. I'll start with the introduction to what Noma is and why it's such a devastating disease. Then I'll go over the key environmental factors that contribute to Noma's spread and prevalence. And then after that, I'll be talking about the living conditions that are associated with Noma and why these um, they make the communities more susceptible to infections and Noma. And then finally, I'll be discussing preventative measures and actions. Some of these are already in action and being done, and I'll also be talking about what can be improved and what can be done more or pushed further to improve the situation. And I'll have a conclusion at the end to wrap things up and just recap everything. So this is the introduction. So Noma, or Cancrum oris, is a rapidly progressing necrotizing infection that mainly affects children living in extreme poverty. So what necrotizing means is it causes tissue death, so it eats away at your tissue. It usually begins as a small gum or cheek infection, but spreads very quickly and very aggressively. It eats away at both your soft and hard tissue, mainly around your face and your jaw area. The disease is very common in the sub-Saharan region of Africa, which is the green shaded area in this image over here. And it's so common in these areas because the poverty rates are high and access to healthcare is limited. According to the World Health Organization, there are about 140,000 new cases of Noma each year. And without quick and early treatment, the mortality rate is 90%. That is extremely high. And in 2023, the World Health Organization finally classified Noma as an NTD, or neglected tropical disease. And the reason why it's neglected is because it doesn't receive as much attention, funding, and research, even though it's been around for a long time. So this is the environmental and other factors that come into play. So one of the most significant environmental factors contributing to Noma is the lack of access to clean water. In poor regions such as Sokoto state of Nigeria, many people rely on contaminated water sources like ponds, streams, and shallow wells for drinking, cooking, and hygiene, and basically everyday practices. And the reason why they are contaminated is because they're often outside, unprotected, or untreated, and they're exposed to harmful bacteria. So this makes infections a lot more likely. There are a lot of studies from Laos and other poverty-stricken regions that confirm that there's a direct link between poverty, contaminated water, lack of access to clean water, and diseases like Noma. Additionally, inadequate sanitation, waste management further exaggerate the problem. In many rural communities, waste is not properly taken up or disposed of, and open defecation is still kind of common in those areas, so it really increases the risk of contaminating water and food sources, leading to health risks and infections. And another environmental risk factor is the close proximity of livestock to the human living areas. In these many poor communities, they keep animals such as goats, chickens, and cattle, and they just sort of live alongside the humans, and this increases exposure to bacteria or waste from these animals, and yeah, it's a health risk. So this is the living conditions slide. So besides the environmental factors, there are poor living conditions that play a key role in the prevalence of Noma. Malnutrition, or especially undernutrition, weakens the immune system and increases the risk of Noma. Vitamin deficiencies in the essential vitamins like vitamin A, vitamin C, and vitamin B complex cause oral tissue breakdown, which increases the likelihood of bacterial infections that eventually lead to Noma. Poor oral hygiene is another main factor. In many poor regions and communities, people lack access to proper dental care, and instead of toothbrushes and toothpaste, they use chewing sticks or just their fingers in water to brush their teeth, which obviously is not sufficient to maintain proper oral health, which contributes to the development of the disease. So poverty directly links to malnutrition, poor oral hygiene, and unsanitary living conditions, and limited healthcare infrastructure as well, because these areas don't have a lot of access to proper healthcare or other resources. And so this prevents early diagnosis and treatment of Noma. Many people don't even know what Noma is, even though it happens everywhere in the region. So by the time that it is actually recognized, it's often too late for effective treatment. This is my preventative measures in action slide. So since Noma is closely tied to poverty and poor living conditions, prevention efforts have to focus on improving the basic needs like clean water, sanitation, and nutrition. One of the most effective ways to prevent Noma is by ensuring access to clean water. Communities need better wells and filtration systems to reduce exposure to contaminated water. Sanitation improvements like proper waste disposal and better hygiene practices are also essential in preventing these bacterial infections. Nutritional programs can help address the widespread issue of malnutrition. Vitamin supplementation and improved food security and food sources is crucial in helping strengthen the immune systems and preventing diseases and infections from attacking the people. Vaccination efforts also play a key role in preventing Noma. Diseases like measles are precursors to Noma, and they significantly weaken children's immune systems, making them more susceptible to bacterial infections. So expanding vaccination programs would help lower the risk of Noma significantly, and it would be very good if we could increase funding and effort towards these programs. Another critical aspect of prevention is improving the healthcare accessibility. We need mobile clinics and telemedicine because they can provide medical assistance to sort of more remote or secluded communities. Additionally, we need to train healthcare professionals to recognize early symptoms of Noma so we can treat patients faster and increase the high survival rates. So there is already some sort of mobile clinic, but it's not enough. There's just a few, and it's not enough to combat the rapidly spreading Noma. And the reason why mobile clinics would be so helpful is because a lot of these communities are more secluded, isolated, and harder to reach. So they can't really take the patients to proper hospitals or clinics that are in the major cities, and these mobile clinics can easily reach those more secluded communities, and yeah, it'll be super helpful. And finally, public education is extremely important. Spreading awareness about oral hygiene, sanitation, and Noma. Noma itself can really inspire communities to take preventative action and seek early medical intervention. And I believe that's very important because the main reason why it's spreading so quickly is because these communities don't really know much about it, even though they see it all the time. But once they really understand the root of Noma and why it's prevalent, they will take action for sure. And so this is my conclusion. Noma is a very preventable disease, but it continues to devastate communities due to poverty, lack of health care access, and poor living conditions. Effective prevention requires many different approaches addressing water quality, sanitation, nutrition, oral hygiene, healthcare infrastructure, and also increasing awareness and education. Collaboration between governments, international organizations, local communities is very necessary to plant these sustainable solutions. The World Health Organization's recognition of Noma as a neglected tropical disease in 2023 is a big step forward to increasing global awareness and action. And with continued research, improved healthcare access, and just dedication with efforts toward prevention, we can really reduce the prevalence of Noma and its devastation on the lives of the people. And so that is my presentation. That's my project on Noma. I really hope you enjoyed my presentation and learned something. And yeah, thank you for listening.